Respiratory airflow is governed by the principles of flow, pressure, and resistance. The flow of air is directly proportional to the pressure difference between 2 points and inversely proportional to resistance. The greater the resistance, the slower the flow of air. There are 2 main factors that contribute to resistance: the diameter of the bronchioles and pulmonary compliance. The large number of bronchioles, their small diameter, and their ability to change diameter makes them the primary means of controlling resistance. An increase in the diameter of a bronchus or bronchiole is called bronchodilation, and the reduction in diameter is called bronchoconstriction. Pulmonary compliance refers to how easily the lungs expand during the pressure change generated by inspiration. A person with less pulmonary compliance or stiff lungs will have a more difficult time filling his or her lungs with air, because even if the thoracic cage expands fully, the lungs do not. The respiratory epithelium is coated with a thin film of water, which is necessary for gas exchange. However, water molecules are attracted to each other by hydrogen bonds, creating surface tension. Left unchecked, parts of the airway would collapse with each expiration and would strongly resist reinflation. However, there is a solution. The great alveolar cells secrete an agent that disrupts the hydrogen bonds of water and reduces surface tension. It's called pulmonary surfactant. The pulmonary surfactant is composed of partially hydrophobic molecules spread out over the surface of the water film. As the small airways deflate, the surfactants are squeezed close together. If the air spaces were covered with a thin film of water only, they could continue collapsing because the water molecules can pile up into a thicker film of moisture. But the physical structure of the surfactants resists compression. They cannot pile up into a thicker layer because their hydrophilic regions resist separation from the water below. As they become crowded into a small area, they resist layering, and this slows and then halts the collapse of the airway.